Since I was 7 years old, my grandfather allowed me to give him his insulin injections, check his blood glucose, and I was just fascinated with being able to do the shots and the pricks and all by myself. And I knew I was a little different when my cousin and I had a sleepover at our grandparents' house, and I was like, girl, Papa is gonna let us do his insulin shots. And she looked at me like, I don't want to do that. So I knew then I was like, I had a different calling on my life to take care of people, and I enjoyed being with him. I remember he had a cabbage when I was probably about 9, and wanting to visit him in the hospital and just know, why do you have diabetes, Papa? Why did you have to have heart surgery? Why? I was always a very curious child, and I always asked why. Now, at some point in my life, someone tried to dim my light and tell me I asked too many questions and I talked too much, but I'm glad I didn't let that stop me from continuing to be curious about things. My grandmother thought I should be a nun because of the display of empathy and always wanted to take care of something or someone. It was just always in me as a child. I always wanted to take care. It brought me great joy and passion to help and take care of someone. I enjoyed. My grandfather had cellulitis. Even when I was young, I would take care of his dressing changes. I just have always been like this. Stuff didn't gross me out or whatever. I was just drawn to do it because I wanted to be of service and help someone in their time of need. Now, getting to anesthesia part, I knew I wanted to be a nurse. I always thought I was a nurse. My grandfather would call me a little nurse. I was like, well, I just got to go to school and make it official because I'm a nurse already. And I really looked up to my auntie / godmommy, who was a registered nurse. And right before I left for college, she told me, she was like, Ashley, you're very smart. You should look into becoming a CRNA. Now, this is the early 2000s. This is before people coming on expressing, doing this, what we're doing now, talking about what we do and who we are. So the most I could find on CRNA is a nurse who has an advanced practice, who has autonomy, delivers anesthesia, take care of patients. And I was like, I got the wheels turning. This sounds interesting. And my auntie let me know I would need to work in the ICU to continue on to become a CRNA. Now, working in the ICU, I absolutely loved. I love to take care of people. So it didn't feel like, oh, this is just a stepping stone for me to become a CRNA. I enjoy being a nurse. And for me, it's the ability to go even deeper into my care as a nurse. I can really get into, why does this medication work for the patient? Why does this treat their blood pressure? Why is their blood pressure dropping? If you are a person who loves to go down the rabbit hole of why, anesthesia is probably for you. Now, bedside, you're answering the orders and you're doing the bedside care and doing tasks. There are times where you can get into the why, but not as deeply as when you become a CRNA. You are sitting there constantly, why am I giving this drug? What is it going to do for the patient? You are constantly in your mind scratching that itch of why. Even studying for becoming a CRNA was so intriguing to me. Yes, it was a lot of information, but it is so interesting and fascinating to learn how your body works and how these medications work on the body and how we can give things to manipulate situations to make a patient optimized for surgery. Something simple as paralytics and the importance of having relaxation for, what do we do for muscle or for insufflation? And you can really go down the rabbit hole if you're someone who is very curious and you want to know why and you like studying about the human body. So for me, becoming a CRNA not only allowed me to feel like I was practicing nursing at a very high level and having a lot of autonomy to really take care of my patient and still put hands on and actual care, it also allowed me to scratch that itch of curiosity of why do we do this? Why do we do that? So that's why I'm always asking why. That's one of my favorite questions. Even of course, I take it outside of just working as a CRNA. I always want to know, why does this person act like this? Why do they do that? Then I could drive myself crazy with the whys. But for me, being a CRNA is me deepening my practice as a nurse. I am able to really share my gift of empathy. I can share my integrity, my love for people, and being there for someone in their time of need when they're vulnerable. That brings me joy. I am trustworthy. I have a lot of integrity, and I will take care of whoever God puts in front of me. They're my own loved one. And I will always go above and beyond and do what is necessary for them in that moment when I know they can't do it for themselves. So also, while I was pursuing becoming a CRNA, like I said, it was like early 2000s, so social media wasn't what it is now. It was almost like trying to find a unicorn because I'm like, where are the CRNAs at? I worked in the medical ICU and I worked night shifts. So for me, I wouldn't come across CRNAs or even anesthesia providers in general, just based on the unit I worked in. I think if you work probably in surgical ICU or CVICU and the anesthesia team is bringing the patient back to the unit, you probably get more interactions. But for me, it was just like this unicorn profession, which made me drawn to it even more because I'm like, I want to be in this career that seems pretty rare. It seems It's definitely competitive, so that became something within myself. I can do hard things. Even though it seems like it's out of touch, it drew me to it even more because I'm like, I want to do this. And I think it was after a year of nursing in the ICU, I went to a diversity CRNA conference at Duke University, and that just solidified. I met other nurse anesthetists who look like me, who talk like me, and it definitely helped with the imposter syndrome I was feeling about, can I do this? I don't see too many people who look like me doing this type of thing, so maybe it might not be for me. But after that weekend that I spent was so empowering and so motivating, and definitely gave me the push that I needed to take that next step and pursue it. Because I'm like, I've met some people who look like me, like me, and we share similar backgrounds, so it made it seem like a possibility. And also now, as I live this life as a CRNA, I feel like I hold a duty to inspire other women of color who are interested in pursuing the career, just so I feel like the weight I carry is heavy. I got to pass the torch. And not only do I want to pass the torch, I want to make sure that it's easier, or you know what I mean? It doesn't need to be as hard as it was for me. If I can lighten the load and make the path a little clearer for you, that's what I want to do. I'm not trying to pass on pain and trauma and struggle. No, why? For what? If I can make it easier for the next person, that's absolutely what I want to do. I want to make your path with least resistance as possible, because I know a lot of times that the resistance comes up here. Sometimes we can be a prisoner of our own mind and thoughts, and that will hold us back more so than anything else. So I'm here to encourage and inspire and help the next person do it a little easier than I had to. We have all these resources, because trust me, the work starts when you get into school. Nobody can do the work for you. You're going to have to study. You're going to have to learn the skills. You're going to have to put in your time. You're going to have to put in your work. You're going to have to pass boards. So me opening the door for you and giving you your tips and keys to walk through that door, that just gets you in the door and they get you the seat, right? And then it's up to you to put in the work that needs to be done so that you can become this skillful, competent CRNA. So I hope this long-winded answered the question to why I pursued being a CRNA and what it really means to me to be in this position. Now go be blessed.